and welcome back to our ISI video channel where we discuss various topics related to international students and their health insurance needs. The US healthcare system is unlike any other, and for those that are unfamiliar, knowing where to go to seek treatment can be challenging to navigate. Today, we're going to be chatting with ISI's Eric Bloodworth on the different types of places to seek care and when to visit them. Eric, hi. Thank you so much for joining us this morning and providing us with your expertise in this area. Could you tell us a little bit more about your role here at ISI and explain the differences with the different types of providers out there?
Sure. Hi, Sally. It's great to be here, and thank you very much for having me. Here at ISI, I am a insurance customer service representative, and I also work with our university relations team. Every day, I answer phone calls or emails about which doctor's office a student should go to. It's a really common question because there are so many different types of service providers here in the United States that may not exist in other countries. Some of the most common ones would be primary care offices, walk-in clinics, urgent care centers, and the emergency room. The different types of medical care providers here in the United States are often referred to as providers. And providers are places like doctors' offices, clinics, or hospitals, and also people such as doctors, nurses, surgeons, and emergency medical technicians, or EMTs.
Right. There are so many different places to seek treatment in the US, unlike in other countries where one would just go to the hospital for any sort of condition or illness. So could you give us some examples of when to seek treatment at these different providers?
I'd be happy to. So primary care doctors are by far the most common type of provider here in the United States, and they can help out with things like your yearly doctor's checkup, routine blood work. They can diagnose common illnesses and also help manage chronic illnesses. They always require an appointment, and also if something is outside of that doctor's area of expertise, they can refer you to a specialist who can help you. More minor things like headaches or the flu or a case of strep throat can be quickly and cheaply resolved at a walk-in clinic. Walk-in clinics can be found in pharmacies like CVS or Walgreens or Walmart, and they do not require appointments. More serious things, such as a sprained ankle or sprained wrist, minor bone fractures, mild allergic reactions, are really more suited for urgent care centers. Urgent care centers, depending on the facility, may have access to blood work for labs, or labs for blood work rather, and also things like x-ray machines, again, depending on the facility. Urgent care centers often don't require appointments, but it's still a good idea to give them a call before you show up, just to make sure you're not waiting an hour.
Right. So it sounds like walk-in clinics or urgent care centers are the easiest and most convenient places to seek treatment for common injuries, like you said, and illnesses that don't require that extensive treatment or are life-threatening. When should someone be going to the emergency room in the United States?
Here in the United States, the hospital and emergency rooms are reserved for exactly that, true emergencies. If you severely break a bone or having an extreme allergic reaction or having symptoms of a life-threatening illness, like chest pains or you might be having a stroke, please go to an emergency room. Going to the emergency room for things like minor sprains or illnesses isn't a good idea, and we don't recommend it because the emergency room is the most expensive place to seek care here in the United States. Emergency rooms, of course, don't require appointments and are open 24 hours a day, 7 days a week.
Right. So don't go to the emergency room unless it's a true emergency. I'm sure with talking with international students on a daily basis, you may have come across a few instances where they went to the emergency room for something minor. And like you said, it can be very expensive, even if you do have a good insurance plan. And speaking of insurance, how does health insurance play into all of this?
So health insurance is absolutely a necessity here in the United States in order to avoid the high cost of medical care. If you do wake up with the flu or break your leg, having an insurance plan will greatly reduce your out-of-pocket costs. Without health insurance, a trip to the emergency care center could run you a few $100s, and a trip to the emergency room could run you a few $1,000s. I really can't, or even if you do have a good insurance plan, there's often higher deductibles or higher copays associated with going to the emergency room. I can't emphasize enough that emergency room visits should really be reserved for emergencies.
Yeah, yikes. No one wants to pay thousands of dollars when going to the emergency room. So very important to save where you can and go to those walk-in clinics or urgent care centers, as you've been saying. So undoubtedly, health insurance is a necessity in the United States. Let's say you have a plan, but maybe it's not covering something that you're looking to seek treatment for, go to the doctor for, maybe a sports physical or routine vaccinations that you need for school. What would you recommend in this instance?
Sure. So many urgent care centers or walk-in clinics have very standard pricing for certain procedures, like that sports physical, or say like the MMR tetanus vaccines, common ones that schools require. So you can give them a call beforehand and ask just how much those would be without insurance, and they'll give you the price for it. This really is useful to avoid out-of-pocket, or rather unexpected out-of-pocket costs. Telemedicine is also a great option for minor illnesses and mental health as well, as you don't even have to leave your couch to get medical treatment. You don't need appointments, and oftentimes it's cheaper than actually going to a doctor as well. Depending on your plan, maybe only a copay applies, but again, that is very plan dependent.
Perfect. Yeah. Thanks, Eric. There's definitely been a noticeable rise in popularity with telemedicine throughout this pandemic. And it's a great convenient alternative. Like you said, you don't even have to leave your couch, super easy and convenient, and also not as expensive. We really appreciate all of your insight today. Thank you so much for joining us and sharing all of this information.
Of course. Thank you for having me, and I'm happy to help.
Great. And if you all have any questions about insurance or where to seek care, you can always give our customer service team a call anytime and get your questions answered. Additionally, we also have a U.S. healthcare system explained video that you can check out. It has subtitles in multiple languages and is available on our website. Thank you so much for joining, and we hope to see you all next time.